Welcome to the deep dive.
Glad to be here.
Today we're digging into a really interesting corner of the homeopathic world.
Calcarea Flourica.
Exactly. Calcarea Flourica, or fluoride of lime as it's sometimes known.
And our main source is William Boericke's Homeopathic Materia Medica, right? A classic.
The classic, yeah. So our mission for you today is to really peel back the layers on this substance. We want to understand its uses, which are, well, surprisingly broad, and figure out why Boericke called it a powerful tissue remedy.
That phrase really stands out.
It does. So if you've ever wondered how one, natural substance could potentially touch on everything from fears to cataracts to varicose veins, well, this deep dive should shed some light. Okay, let's get into it.
Yeah, okay. So that description from Boericke, powerful tissue remedy, it's not just a casual label.
Right. What does that really mean in homeopathic terms?
Well, when we talk about a tissue remedy, we're basically thinking about something that works on the body structure itself. There's connective tissues, elasticity, the whole physical framework. Boericke flags it for things like hard, stony glands, those enlarged or varicose veins, and even issues with bone nourishment. It's foundational stuff.
So it's almost like it's working as the body's, internal architect, making sure everything's solid and resilient.
That's a good way to put it, yeah.
Because the source also points to its use for conditions like hard knots in the female breast and goiter.
Right.
And it mentions induration threatening suppuration, which, just for everyone listening, basically means tissue hardening up so much it might form an abscess, something you definitely want to avoid.
Definitely.
But here's where it gets really interesting to me. Boericke notes it has undoubtedly influenced favorably many cases of cataract.
Yeah.
That seems like a very specific, kind of bold claim for a remedy focused on general tissues.
It is bold, absolutely.
Yeah.
And it circles back to that core idea of induration, the hardening.
Okay.
Whether it's glands or breast tissue or even potential adhesions.
Yeah.
Those fibrous bands after surgery, Calcarea Flourica seems drawn to that state of rigidity, that structural change.
Right.
But then, if you look at the bigger picture in Boericke's text, it expands. He talks about arteriosclerosis, hardening of the arteries.
Oh, okay.
Threatened apoplexy, which is basically stroke, and even some types of tuberculosis.
Whoa.
Which suggests it's not just about physical structure, but maybe maintaining the crucial elasticity of vessels and organs too.
It's fascinating how something linked to physical structure also seems to touch on things that feel less tangible. I mean, beyond the big structural stuff, the source gets into really specific symptoms, right down to the mind and individual body parts. Like for the mind, it notes Great Depression and groundless fears of financial ruin. That feels pretty specific for a primarily physical remedy, doesn't it?
It does, yeah. And it really highlights a core idea in homeopathy,
Yeah.
that the mental and emotional state is intrinsically linked with the physical.
Right, the whole person.
Exactly.
Yeah.
So those groundless fears about money, for instance, maybe they're like a psychological echo of that deeper internal rigidity or insecurity that Calcarea Flourica targets.
Huh. Like a lack of flexibility in dealing with life, mirroring the physical hardening?
Could be, yeah. It's one way to look at it. And then if you look at the head symptoms, physically, you see that theme again. Abnormal growths, odd sounds.
Like what?
Things like creaking noise in head, blood tumors of newborn infants, and hard excrescences on the scalp, growths, hardness.
And the eyes, it gets really detailed there. Flickering, sparks, spots on the cornea, conjunctivitis, and those cataracts we talked about.
Yeah, whole list.
It even lists, strumous flectennular keratitis, which is basically a kind of eye inflammation with little irritating nodules on the cornea, and subcutaneous palpebral cysts, like little cysts under the eyelid skin. It really seems to zero in on eye conditions involving growths, hardening, or, structural changes.
Absolutely. And the ears show a similar pattern. You see calcareous deposits on tympanum.
Chalky deposits on the eardrum.
Exactly. And sclerosis of vesicula and petrous portion of temporal bone. That's hardening of the tiny ear bones and parts of the skull.
Leading to deafness, ringing.
Right. Deafness, ringing, roaring sounds, even chronic suppuration of middle ear makes the list. It just keeps reinforcing this idea of taffling, calcification, and abnormal hardening in really delicate places.
The nose gets mentioned too. From just a simple stuffy, cold, and dry coryza to something more severe like ozena.
Which is that chronic inflammation with a really strong, unpleasant odor.
Yeah. And it describes the discharge in detail. Copious, offensive, thick, greenish, lumpy, yellow nasal catarrh. and atrophic rhinitis, especially if crusts are prominent. It paints quite a vivid picture of the specific kind of nasal issues it might fit.
It really does. The consistency, the color, the crust, those details are often crucial for homeopaths trying to match the remedy precisely.
Makes sense.
And this theme of hard swelling just keeps going. Face and mouth symptoms include things like hard swelling on the cheek or a gum boil with hard swelling on the jaw. It's very consistent with its action on fibrous tissues.
Even the tongue isn't missed. It mentions a cracked appearance and induration of the tongue, meaning hardening after inflammation.
Right.
And then there's that kind of paradox you mentioned earlier, teeth becoming unnatural looseness in their sockets, painful when food touches them.
Yeah.
So it's not just about hardening things up, is it? It seems to be about supporting the right kind of firmness and integrity. Sometimes that means less rigidity where it shouldn't be and more stability where it's needed.
Precisely. That's a really key point. Calcarea flourica isn't just hardening or softening. It's about restoring the optimal elasticity and integrity to tissues. Where there's too much rigidity, it helps soften. Where there's weakness causing things to be too lax, it helps strengthen it. It's like a rebalancing act.
Gotcha.
And the throat symptoms mentioned, like follicular sore throat with those plugs of mucus and hypertrophy of Luschka's tonsil, that also points to chronic inflammation and structural changes there.
And then the stomach. It covers a lot. Vomiting of infants, undigested food, hiccups, flatulence. There's a note I found particularly interesting. Weakness and daintiness of appetite, nausea, and distress after eating in young children who are overtaxed by studies.
Yeah, that's very specific.
And acute indigestion from fatigue and brain fag. It directly links that mental or physical exhaustion to digestive problems.
It's fascinating, isn't it, how Boericke connects that mental strain, overtaxed by studies, brain fag, straight to physical digestive symptoms. It just underlines that holistic view we talked about.
It really does.
Moving further down the body, the source lists things like diarrhea in gouty subjects, fissure of the anus, bleeding hemorrhoids,
Right.
and internal or blind piles, often with pain in the lower back.
Uh-huh.
And it adds details like much wind in lower bowels and worse pregnancy, more context for a practitioner.
It keeps going. For male-specific issues, hydrocele, that's fluid collection around the testicle and indurations of the testicles, are listed. Hardening again.
There it is again.
And then for respiratory organs, hoarseness, croup, a cough with expectoration of tiny lumps of yellow mucus. And then there's this really quite remarkable claim attributed to an Eli G. Jones, MD, stating it removes fibroid deposits about the endocardium and restores normal endocardial structure. That's the end test.
Well, that's a huge statement about heart health, almost suggesting you can repair heart tissue.
It absolutely is huge.
Yeah.
And it powerfully emphasizes that core theme of Calcarea flourica, addressing fibrous, hardened deposits everywhere, even in delicate heart structures and blood vessels.
All right.
Which leads right into its role for the circulatory organs. It's called a chief remedy for vascular tumors with dilated blood vessels, and specifically for varicose or enlarged veins.
Okay, so varicose veins is a big one. Seems to be. Aneurysms and valvular disease are also mentioned. It really strongly suggests it helps maintain vascular elasticity and strength.
It's about getting that balance right, firmness and flexibility in our internal plumbing, you could say.
Like a restorative tonic, maybe. Not just for overall structure, but specifically for the whole circulatory system.
That's a good way to think about it.
And then neck and back aren't forgotten either. Chronic lumbago, notably, aggravated on beginning to move and ameliorated on continued motion. That's a modality, right? A key condition that makes things better or worse, like a unique fingerprint for the remedy.
Exactly. That better by continued motion is very characteristic, often a defining symptom for Calcarea flourica. It helps differentiate it.
Okay.
Plus, it mentions osseous tumors, bone tumors, and rachitic enlargement of femur in infants, rickets affecting the thigh bone.
So again, confirming its role in bone health and abnormal bony growths really hammers home that tissue remedy identity across the skeleton too. Absolutely. And then in the extremities, we find ganglia, or encysted tumors at the back of the wrist.
Like ganglions.
Yeah. Gouty enlargements of the joints of the fingers.
Yes.
Chronic synovitis of knee joint, all pointing to problems in joints and connective tissues that have lost their proper structure or elasticity.
Even sleep gets a mention. Vivid dreams with sense of impending danger and unrefreshing sleep. But where this remedy really seems to, double down, as we've kind of touched on, is the skin.
Definitely.
Marked whiteness of skin, scar tissue, adhesions after operations, chaps and cracks, fissures or cracks in the palms of the hands, hard skin. It sounds like a repair kit, not just for damaged skin, but for the underlying tissues that give skin its strength.
It totally reinforces that tissue remedy idea. The descriptions are so vivid. Suppurations with callous hard edges.
Meaning pus-forming sores with tough, thick borders.
Right. And indolent fistulous ulcers, secreting thick yellow pus. Ulcers with hard, elevated edges, and the skin around them being purple and swollen.
Wow, very specific.
And back to those knots, kernels, hardened glands in the female breast. The source just consistently emphasizes indurations of stony hardness.
Stony hardness.
Yeah, and swellings in the fasciae and capsular ligaments of joints or in the tendons. This consistent detail, pointing to that same underlying issue of compromised tissue integrity or excessive hardening, really helps guide its specific use.
Okay, so bringing it all together.
Yeah.
What's the overall pattern? The modalities seem key, right? It says worse during rest, changes of weather, and better heat, warm applications.
Yes.
That better by heat seems pretty important, along with the better by continued motion we mentioned.
It really is. These modalities give crucial practical clues for homeopaths trying to figure out if Calcarea Flourica is the right fit. They're often the strongest indicators.
Makes sense.
And the source also gives comparisons to other remedies, conium, lapis, Brita muriatica. That's typical for a materia medica. It helps practitioners tell remedies apart that might seem similar but differ in these subtle but important ways.
Right, distinguishing features.
Yeah. It even points to Mangifera indica for varicose veins, just showing there are other options depending on the specific details of the case.
And finally, there's dosage info, 3rd to 12th trituration. And it notes it's a chronic remedy that needs some time before manifesting its effects and should not be repeated too frequently.
Right.
So definitely not a quick fix for something acute, but more of a deep acting remedy for those long-standing chronic structural imbalances.
Exactly. It really highlights the sort of slow and steady approach of homeopathy for chronic conditions.
Yeah.
It's about restoring balance over time,
Yeah.
tackling those deep-seated structural problems, not just the surface symptoms.
Yeah.
I mean, the sheer range of conditions described here, from mental states like those groundless fears all the way to severe skin problems and vascular issues, but all circling back to this theme of hardening, structural integrity, and tissue repair. It really makes Calcarea Flourica a fascinating study in how homeopathy looks at the body's fundamental architecture.
It really does. So thinking about everything we've covered, from the big picture tissue repair to the very specific symptoms like cataracts or those financial fears, what aspect of Calcarea Flourica's sphere of influence do you think is most compelling for listeners to reflect on? Perhaps how it seems to bridge that gap between the physical hardening and the mental or emotional state.